drooping face, slurring words, and a sudden collapse. If you see any of these in someone, they call 000 immediately, because they are suffering from a stroke. And the sooner you get them to a hospital, the better chance they have of surviving. What actually is a stroke though? Well, let's have a quick look at the brain first. Here is a simple diagram of the brain, showing all the major parts here. The frontal lobe, parietal lobe, occipital lobe, cerebellum, and the temporal lobe. Now here is a much more complicated diagram of the brain, showing the arteries and the veins, as shown in the little strokes over here. Now these incorporate the blood supply, and without this blood supply, it will start affecting all the major areas of the brain, depending on where it occurs, of course. And this is a stroke, the loss of a blood supply and further causing brain damage. Since stroke is caused by the loss of blood supply, there are two main ways in which the blood supply is disturbed. First is the stoppage of blood flow, and the second is the rupture of a blood supply. The stoppage of blood flow is the more common one, as anything could stop from blood clots. As anything could stop it from blood clots over here, where it's blocking the artery here, and anything, it could be anything from blood clots to cholesterol. And as this happens, the area on the other side of the clot, which isn't getting oxygen from the blood supply, is being damaged, as seen in the red area up there. Now the second type is the rupturing of the blood vessels, which is a much more rare occurrence. For example, the artery over here pops and starts to cause internal bleeding, which has two effects. One, it stops the flow of blood flowing towards the latter parts of the artery, just like a stoppage of blood flow. And secondly, the internal bleeding actually builds up in these areas between the skull and the brain here, causing pressure against the brain and further damaging the brain tissue over there. Depending on where these strokes occur though, they can produce various symptoms ranging from minor symptoms such as dizziness or balance issues to the extreme, such as death. The most common of these symptoms, however, are sudden numbness or weakness in the face, such as over here, sudden trouble speaking or understanding, as well as various visual impairments, partial or otherwise. These symptoms can also include sudden severe headaches with no known cause, which is mainly, sudden severe headaches, which are mainly due to a rupture in the artery, causing the blood to fill in between the skull and the brain, causing pressure again. Again, these symptoms, depending on firstly where the stroke occurs, and two, which parts of the brain the stroke is affecting. Although most victims do survive the stroke, however minor they may be, most stroke victims are left with lifelong complications and disabilities that the sufferer must continue to live with for the rest of their lives. Conditions such as speech impairment and walking disabilities are often the case with most victims, as a result of the cell death that occurs in the brain tissue that associates with the walking impairment or the voice impairment. Remember, it only takes as little as 3 minutes for cells to start dying when they stop receiving oxygen from the blood supply. However, a group of 10 scientists led by Ying Wang have found a way to reverse the effects of a stroke through stem cell research. And although it is a controversial topic that we are talking about here, instead of using the fresh stem cells obtained through fetuses, they are actually using the dormant stem cells from within the brain. They've done this by using a variant of the activated protein 3K31 activated protein C, to be exact. What this protein has been shown to do is trigger the transformation of human neuronal stem cells to change into functional neurons, essentially turning the dormant stem cells into fully functioning brain cells, which are able to replace the damaged ones caused by the stroke. The test done upon mice revealed that those who have suffered strokes improved immediately. More incredibly, Treatment was done several days after their stroke, which is far longer than a critical treatment time, which is within 3 hours of a stroke, which is in order to prevent significant damage, not just partial damage. If this treatment passes clinical trials, not only will not be able to treat new patients, but also older clients who have had a history of strokes. However, the applications for this treatment reach far beyond just stroke victims, applying to almost any neural disorder and possibly a universal brain tissue treatment. Cheers.